Hold up. The L0ck Hospitals, most famously represented by the L0ck Hospital, established in 1746, were institutions dedicated to treating venereal at a time when understanding of such medical infections was rudimentary. The hospitals emerged partly out of genuine public health concerns and partly out of the heavy social stigma surrounding sexually transmitted infections. Women were disproportionately affected because they were more easily blamed for the spread of infections, especially under the gendered moral standards of the 18th and 19th century in Britain. Many female patients were admitted not purely for treatment, but under the assumption that they required moral reforms as much as medical care. In practice, this meant women, often poor, working class, or workers, were scrutinized more harshly than men for conditions both sexes contracted. The L0ck Hospital later expanded with the L0ck Asylum in 1792, intended to rehabilitate women discharged from treatment. But these programs often revolved around strict religious discipline rather than medical fairness. These institutions offered medical care that ranged from rest and hygiene to mercury treatments, which, while standard for the era, were notoriously dangerous. Women receiving this treatment sometimes suffered hair loss, tooth decay, or tremors, all considered acceptable side effects at the time. The hospitals also imposed rigid rules meant to enforce respectability, which created environments where female patients' behavior was monitored as closely as their symptoms. Many women had little choice in admission, particularly under public health systems in the 19th century. While L0ck hospitals themselves predated laws used to enforce them, the laws later became deeply entangled with their enforcement, which often allowed police to forcibly detain women suspected of and send them for mandatory examination. Men, by contrast, faced far fewer legal or social consequences for similar infections. As bacteriology advanced in the 19th century, the punitive moral framework of venereal began to weaken. Some L0ck hospitals were absorbed into broader healthcare systems, while others closed entirely. Their legacy remains complex.